Pop quiz. A nurse is reinforcing a teaching plan to a client who's prescribed Alanopril Vasotec for treatment of hypertension. Which instructions will the nurse expect to include in the teaching plan? Select all that apply. How do we treat select all that apply? As true or false? Let's go. 1. Instruct the client to avoid salt substitutes. True. Why? Salt substitutes are high in what? Potassium. We're not trying to give that patient any cardiac arrhythmias. Remember, potassium has a very narrow therapeutic range, 3.5 to 5. 2, tell the client that lightheadedness is a common adverse effect that may not need to be reported. False. You tell them absolutely if they're feeling lightheaded, they need to report that. Why? We're giving an antihypertensive medication. What happens if that medication works a little bit too well? That patient can pass out. So you absolutely need to report any lightheadedness, any dizziness. 3, inform the client that he may have a sore throat for the first few days of therapy. False. Absolutely not. Matter of fact, you're going to teach them to report any sore throat. Why? This medication, excuse me, this medication can possibly cause leukopenia. And so if their WBCs are decreased, that's going to put them at risk for infection. So we need to know immediately if they have any signs and symptoms of infection. 4, tell the client that blood tests will be necessary every 3 weeks for 2 months and periodically afterwards. False. We really don't see the true effects of this medication for a good 3 months, so we're going to be checking their blood every 3 months, not every 3 weeks. 4, advise the client to report facial swelling or difficulty breathing immediately. True. Facial swelling, angioedema, difficulty breathing, those are medical emergencies. So the patient's going to have to go to the hospital right away, and that medication will be discontinued ASAP. 6, inform the client not to change position suddenly to minimize orthostatic hypotension. True. We're giving them an antihypertensive medication. We don't want them to have orthostatic hypotension. We're going to teach them to get up slowly. We're going to teach them to dangle. We want to make sure that their blood pressure does not drop too quickly.